Welcome. I welcome everyone and thank you so much for tuning back in with Power of Beast Team, where we focus on feminine wellness with alternatives that elevate the female well being. And today I wanted to speak on one of my favorite topics so far. It's about psychedelics, and I love to continue to learn more about it. Today's topic is from psychedelictimes.com, and the title is How MDMA Therapy Could Promote Healing and Bonding After a Difficult Birthing Experience. So let's begin. With her first child, she labored for 4.5 hours after an induction. Due to the fast labor, she required an epidural and fundal pressure during pushing. Despite understanding the necessity of the medical intervention, she had not planned for them, and the negative impact of her challenging first birth made her more fearful going into her second. Both social scientists and medical professionals recognize that giving birth in the modern medical setting can sometimes trigger feelings of fear, helplessness, and a loss of control, which can lead to postpartum depression, PPD, PTSD, and fear of future birthing experiences. Processing a birthing experience with the help of trained professional can potentially reduce these negative effects, and MDMA may play a critical role in assisting women who experience particular difficult childbirths. Understanding the connection between childbirth, PTSD, and PPD. Studies shown that around 5.6% of women experience PTSD after giving birth. However, PTSD can often be misdiagnosed as PPD because they share many symptoms including depression, anxiety, inability to sleep, and difficulty bonding with the baby. Often, after the birth of a baby, women are encouraged to concentrate on the positive aspect of having a healthy baby instead of being given room to process. Hospital staff, family, and friends may try to normalize her birthing experience, and because symptoms may not show up immediately, she may not connect PPD symptoms with childbirth. This can make it difficult to diagnose PTSD versus PPD in new mothers. Processing the birthing experience with the help of therapists may assist women in expressing themselves, working through difficult memories, and gaining a more positive view of the birthing. MDMA assisted therapy is particularly promising because it allows mothers to access the deep, powerful emotions experienced during the birth. This ability could help differentiate between PPD and PTSD by also allowing women to explore the potential cause of their depression and honestly identify their symptoms. MDMA facilitating faster, more efficient treatment. MDMA shows promise as a therapeutic tool for healing mothers because of its potential to help individuals open up about traumatic experiences and begin integrating and accepting them. Recent MAP studies have shown MDMA to be effective in treating 83% of PTSD cases. It does this by increasing activity in the brain's frontal lobe, which helps an individual regulate emotions while decreasing the natural fear response trigger when recalling a painful event. This allows individuals to feel secure while discussing and thinking about events that may otherwise be too traumatic to talk about. Dueling the fear response in this way would allow women to process their experience on an intellectual level and facilitate healing. MDMA also plays a unique role in treating new mothers with PTSD after a difficult birthing experience because of its short treatment period. MDMA may be effective with just a few sessions of psychedelic therapy, whereas SSRI has to be taken regularly over a long period of time to be effective. Many new mothers do not seek treatment for PPD or PTSD due to the long, involved treatment taken away from their mothering duties and limiting their ability to breastfeed. By limiting the number of medicated sessions, a woman may be able to continue caring for and breastfeeding her baby. However, it is important to note that MDMA is only shown to be effective at reducing PTSD if combined with intentional use in a therapeutic setting. Oxytocin in connection, a path to bonding. One important aspect to realize about birth related PTSD and PPD is that it affects both the mother and newborn negatively. Mothers with PTSD or PPD often have trouble bonding with their babies. This has been shown to be related to low level of oxytocin, a chemical that increases pro-social feelings and bonding. Many researchers believe increasing a woman's supply of oxytocin can help reduce PPD. While research into the exact relationship between oxytocin and PPD is still being conducted, recent studies have shown that exogenously supplied oxytocin does not have a positive effect on human subjects that researchers hope it would. However, research have shown that MDMA can encourage the natural production and release of oxytocin. Unlike exogenous oxytocin, oxytocin stimulated by MDMA has been positively correlated with pro-social feelings and a sense of bonding. This can potentially help mothers suffer from birth-related PTSD or PPD to connect with their babies. Additionally, the increased levels of oxytocin induced by MDMA therapy may increase bonding with a therapist, thus increase in effectiveness of therapy session and helping women who may have difficulty trusting healthcare professionals become open to expressing their feelings. Recognizing and mitigating risks. While there are potential benefits of MDMA assisted therapy for mothers who experience a difficult birth, it is also important to recognize the potential risks of this type of treatment. For an example, MDMA may pass through breast milk to the baby. If a mother is breastfeeding, it may become concentrated in breast milk over time. For this reason, a mother may have to temporarily stop breastfeeding while undergoing MDMA assisted therapy. Additional studies should focus on how much MDMA passes into breast milk and whether pumping and disposing of breast milk for a short period of time would mitigate this risk. At the same time, it is important to note that MDMA has been found to be especially effective in women and requires a lower dose in women than in men. This makes it particularly attractive as a potential tool for birth-related PTSD because lower dose may make it a safer option for breastfeeding women. However, additional research is needed to find the ideal minimum dose of effective PTSD treatment in women. Currently, she is pregnant with her second child. She is not in a situation where MDMA assisted therapy would be safe for her. However, looking back at her first birth experience and recognizing the long-term negative effect difficult birth experience may have on women, she realized that processing childbirth soon after the event is often necessary. Further research into the connection between birth-related PTSD, PPD, and MDMA therapy is needed, but MDMA holds potential to become a powerful healing tool for women struggling to integrate challenging birth experiences. Wow. Wow, wow, wow. I really appreciate this topic because just the other day on my Explore page, I ran into a video that had a mom with her newborn in her hands and she was crying, confirming that she was experiencing postpartum depression. My heart did feel so sad to know that a lot of women out there is experiencing this and are unable to connect with their babies in reality the way their hearts really yearn to. Immediately, I felt it was appropriate to share this alternative method of healing to help a mother or two out there that is in need of a new perspective or approach of elevating their wellness while also facing the root problem that has caused this domino effect. I do know that this will help someone, and I'm grateful to be in this position of research and sharing the gold nuggets that I've found so far along the way. It is wise to share this video with our feminine community so that we can continue to help each other heal. With that being said, I wish you all a fulfilling day, and with love always, Power V Steam.